Are you with the patient or is the patient on the line? I'll be there in a few minutes.
A7, pull him up.
All of us at any moment in time are at risk of, ourselves or someone we care about having an emergency and needing world-class, first-class care.
88 Adam, 88 Adam.
It's about having enough beds and equipment to treat people quickly, because if you don't, their lives are at risk.
The emergency room has become the center for many people who need care. So in the midst of this very difficult financing environment, you have a critical need for the local community.
Present the best face to the community, you need a first-class emergency center.
And without philanthropy, it just can't happen.
Somebody comes into the emergency room, we're able to tap any conceivable aspect of healthcare you can imagine.
In the past decade, New-York-Presbyterian has made a major commitment to providing emergency services. We are a level 1 trauma center. We are the largest burn center in the Northeast.
The emergency department is the front door of the hospital, and we provide emergency services for all types of patients, from newborn babies to the very old.
Our institution exists for the public good, and there is no greater good than being able to take care of somebody who is in need, in desperate straits, has an acute problem, and to be able to solve that problem.
Our emergency techs are as good as it gets. They get to places fast, they know how to give acute care, they know how to coordinate back with the emergency room, so that care starts almost from the moment you make contact with New-York-Presbyterian.
Our EMTs and paramedics are highly trained. It's a close, tightly knit team, and everybody really works together with the clinicians, with the emergency departments, to really make sure that the best possible patient care and the best patient outcome remains the priority all the time.
It's really a privilege for us to partner with them so that we can extend our care into the streets, into the apartments and homes of New Yorkers.
And our challenge constantly over the years is dealing with a continuous increase in demand for emergency medicine services. The thing that we see most is acute presentations of chest pain, abdominal pain, and trauma.
Any nausea, vomiting, any fevers at home?
Place these leads on you.
We know that the number of people who seek emergency care sometimes overwhelms the ability of all of the hospitals in New York City to deliver it. But at the end of the day, if you think back on 1 or 2 patients who you made a difference for, whose life you may have saved, it makes it all worthwhile.
Hello, EMS. Hi, what's going on? EKG machine. Okay, this is a little bit of oxygen. We're going to take you to the hospital. They're going to do everything for you. We have the best doctors there.
There are so many diseases now that if they're treated quickly and promptly, early in their stages, we can affect outcome. We can save lives.
When I walk through our emergency department, I'm overcome with pride. I'm just so proud of our staff and the way that they come to work each and every day and face the most difficult challenges and take such pride themselves in being a member of this great hospital.
Intermittent diffuse abdominal pain, nausea, vomiting, no fevers. He has a history of gallstones. On exam, has right upper quadrant tenderness.
You do have gallstones, and you're going to need to be admitted. This patient is typical of the patients that come to this emergency department. He has a complicated medical problem, which is going to require several services to provide complete care. He's going to require a surgical intervention and the operating room. He's going to need a gastroenterologist. In the end, he's going to benefit from the high-level services that we provide throughout the hospital.
We meet many challenges. Too many patients, not enough space. But because we get along so well, that's what's kept me here. I've been here for 11 years, and I've loved every minute of it.
This is a great emergency department. I'm here 14 years, and I still love coming to work.
They do a great job. They take care of enormous numbers of patients.
We have a large volume of patients daily. They are either uninsured or underinsured, so they don't get primary care, so they use the emergency department for their care.
Yeah, you're going to be okay, okay? About 30 seconds away from the hospital.
You need, first and foremost, the physicians and nurses, the EMTs and paramedics to bring patients here in a timely manner. When they arrive, you need to meet them with all of the resources that the hospital is capable of providing.
The ability to have a world-class hospital, to have a world-class emergency room, benefits everyone.
A lot of the resources that we provide, not only within the emergency department, but throughout the rest of the hospital. If you're a critically ill patient coming in for a heart attack, then we offer many different types of services that you can't get in community hospitals or smaller hospitals around the city.
In the chair complaining of 10 over 10 chest pain, appeared really uncomfortable.
An ST elevation myocardial infarction. So, let me see. Can you please see acute MI, please?
Yes.
How much chest pain do you have right now? We handle every sort of emergency. No matter how sick a patient is, we can take very good care of them. We have a 24-hour catheterization lab here. Some other cardiologists will be down here soon, but we're going to take care of you here in the ER.
And I will stay at your side, and we'll go up to the cath lab together.
This is a great hospital, not just a good hospital, it's a great hospital. And I'm so pleased and so happy and so fortunate to be associated with it.
It's an honor to be involved with the hospital, the physicians, the nurses, the technicians, and everyone who works there.
At the end of the day, I leave here feeling good. I know I was able to get to each and every patient.
Our emergency departments are under constant strain, 24 hours, 7 days a week.
We need to be able to provide the care for everybody who comes to our door, but it does require a tremendous amount of support.
I try and think of making somebody better or feeling better, getting them on the road to recovery or home.
People should understand that when you invest in the emergency department, you're really helping this hospital to become the very best hospital that it can be.
I'm very happy that we've chosen to honor our emergency medical people, and that Alexandra and Steve Cohn and Richard and Lisa Perry decided we want to help strengthen the emergency medical care at New York Presbyterian. So let's support the best emergency room services in the city. Let's create better and bigger facilities for them. And I want to express my appreciation to both the Perrys, the Cohns, and the other donors who are helping us make our emergency room services first rate.